Now, so you really just emphasized that a monotherapeutic approach doesn't work when there's so many imbalances, but all of the money from the pharmaceutical industry continues to go into monotherapies. Why is it so difficult to switch our way of thinking into realizing that a disease that's this complex in the milieu of the very complex human body requires multiple modalities of therapy?
Yeah, so you've brought up several really good points here. And one of them is just the way medicine is changing. So when I trained in the 20th century, 20th century medicine was about what? What is it? Make the diagnosis.
Right.
Is it Alzheimer's? Is it Parkinson's? Is it measles? Is it a broken leg? What is it? You make the diagnosis, and then either you write a prescription or you send the person to surgery. That was 20th century medicine. 21st century medicine, which will take a while for people to be practicing, is about why. What are all the root causes? What are the factors? And typically with most people with cognitive decline, we find between 10 and 25 suboptimal values. So they have, and Bruce Ames has done a wonderful job over the years showing that about 70% of us are malnourished in one way or another.
Wow.
We don't have optimal vitamin D levels, or we don't have optimal vitamin C levels, or vitamin E, or our homocysteine, on and on and on. And this is contributing to our aging and is contributing to our complex chronic illnesses. And so we want to focus on those things, and that's part of the problem. The other part of the problem is that there's been this idea that if we just keep looking, we'll find a drug.
Yeah.
Now, we've spent time in the lab for years looking at what is the way to get a drug for this disease. And part of the problem is the drug would have to do so many things. We usually make the analogy of 36 holes in the roof, because initially we identified 36 factors, but there are a few more than that. Probably not more than 100, but dozens. So if you wanted to develop the optimal drug, it would have to cover those 36 holes. And that's a lot to ask one drug to do. I think drugs are going to be very important ultimately in the optimal approach to Alzheimer's, but as part of a program. So the hope is that for future drug trials, we would have a personalized program based on your pathophysiology, and then we would plug in where appropriate the drugs, and that the combination could potentially be much more powerful than either one alone.